So let's switch gears to talk about some surgery.
Sure.
So um, when right now you're kind of the neck lift guy on Instagram. That seems to be what a lot of your posts are about, and a procedure that you really enjoy. How did you develop that focus, and where did that come from?
That's a good question. I'm ENT background originally, and then I did a facial plastics fellowship, and I was in university practice for 2 years. Then 2006 entered private practice, and I do all full spectrum. I almost never inject anymore, to be perfectly honest with you. It's only in the training sessions anymore. But I do everything else with related to facial cosmetic surgery. So I do almost no reconstruction anymore unless it's friends and family. So I do all day, every day, aging face and rhinoplasty. Those are the two things that I do. And as far as how did the neck become a focus, people talk about the nose as being the most challenging cosmetic procedure, and it probably still is. But number two is the neck. But unlike the nose is probably the most challenging, and everybody knows it. The neck is right up there, just barely less challenging, and nobody respects it. Everyone thinks it's an easy operation, or it's like, they know no one really understands what a true neck rejuvenation entails if you can do it right. And I just love it, So it's one of the things that has been a passion of mine. I had great mentors. Tim Martin taught me 99% of what I know about the neck. I used to say 100%, but I've learned a little bit, but it's still 99% of what I know about the neck I learned from Tim Martin. And I make sure to say it as often as I can because, he deserved it. He was nice enough to share all that with me. And so that has just become, I think, because almost anyone can do a pretty nice facelift, and almost anyone can do a pretty nice upper blepharoplasty, and lots of people can do nice lower blepharoplasties. Doing a truly beautiful neck lift is still less common, I think. And so for me, it's something I like. It's something where I kind of have a competitive edge, and it has just become it's self-sustaining in some ways. You kind of get known for it.
Yeah. So whether patients or potential patients or surgeons out there that are going to be listening to this, what is it about the neck? Tell our listeners what it is about the neck that makes it such a challenging operation.
Well, I like to talk about the neck, or the evolution of neck lifting, as kind of generation 1, generation 2, generation 3. So neck lifting 1.0 was suction the skin and suction the fat immediately under the skin, and then tighten the skin. And that was kind of neck lifting, or maybe not tighten the skin. That was neck lifting 1.0. And so by analogy, in your belly, that would be, liposuction outside of your abs, plus or minus cut some extra skin away. That was 1.0. But that is the least important layer of the neck, especially in older necks. In older necks, there's almost never significant, meaningful excess fat in that layer. The layer behind that, the platysma, it's analogous to your abs in your belly. So neck lifting 2.0 was like what abdominoplasty is. You get rid of the extra skin. If there is excess fat, you get rid of it, and you tighten the muscles that create the waistline of the abdomen or of the neck. So that was neck lifting 2.0, and it was better. But I want you to imagine, a woman that's pregnant, and you come in with an abdominoplasty and say you're going to give her the scaphoid belly of a 18-year-old, not without delivering that baby. You're not going to get that to happen. And so neck lifting 3.0 is, we're going to set the foundation of the neck to be the shape we want it to be. Instead of taking the precious subcutaneous fat that's left when you're 50 and throwing it away, and then taking the platysma, which is by nature a weak, prone to failure muscle, and somehow trying to tighten it so much that you pack all the non-compressible deep neck structures into the mandible and hope they stay there. Why don't we sculpt the deep neck so it is sitting at the shape you want it to, and let the platysma and skin passively follow that shape? And so that's kind of 3.0. So 1.0 is suction the fat, ignore everything else, maybe take some skin. 2.0 is take the platysma and try to push everything up into the jaw and hide it. And 3.0 is just move the skin and platysma out of the way, sculpt the neck the way it's meant to look, and just put the skin and platysma back. And so we are so programmed to think of looseness and excess fat as the enemies of youth, that treatments that start with tightening and defatting are just doomed to failure, and that's why neck lifts are hard.
Yeah. That what would you say is when you're assessing a patient? Because I'm sure in your practice, very much the same as mine, probably a lot of the other surgeons listening, people come in and say, "Oh, I just want you to liposuction right here. I don't like the way my neckline looks. I need some liposuction." How do you go about assessing that, whether or not that's a valid treatment option, and then explaining that to the patient so that what is a much more aggressive operation in their minds is something that they say, "Okay, I see where you're coming from. That makes sense. Let's proceed."
So if it's soft, pudgy, round, baby fat kind of neck, then liposuction can often be a good choice. It's still usually not the best choice, to be 100% honest, but I mean, it can be an okay choice. If it's soft, pudgy, round, baby fat neck, springy skin, and the floor of the neck feels like it's in good condition, good shape, then you could debulk the subcutaneous layer and get a nice change. That's in my opinion, that is actually pretty rare, and you can start fights with that statement I just made, but it all depends on who's examining what their standards are. So I like a lot more subcutaneous fat left in a neck at the end, in general, because I want the deep. It's like a rhinoplasty, and you want to sculpt all the deep stuff. You're not making the nose smaller by thinning the skin and using camouflage crushed grafts and leaving the framework intact. You want to do all the work on the framework level, and then at the very end, maybe some camouflage grafts, maybe some skin thinning, that kind of stuff. So it's kind of like saying, all right, so you got a person with a big nose. In which cases would you mostly just thin the skin on that nose and not work on the framework? And the answer is almost never, you know. And that's the same with the neck. In which cases do you omit the framework and mostly thin the hypodermis, the fat? It's rare, to be honest with you. Again, 20s baby fat, maybe. The other ones I'll do it with is if it's just like it's the finishing touch. It's not what they're judging me by. They're getting a rhinoplasty and a chin implant, and we're need to take 3 cc's of fat out of their submental zone. It's not the only thing they're hanging their happiness on. That's a pretty good candidate too.
Hmm. Yeah. So I'm going to ask the question. I think I already know the answer. Kybella, thumbs up or thumbs down?